So I wanted to talk about what I was diagnosed with today, and it fits right on with what I've been experiencing. So this might be a long video, at least a 10-minute video. Sorry, my dog is trying to get under my blankets. So I'm just going to read a little bit to you, and I'm going to put the link in the side for you guys, the website that the doctor and I saw a PT/MD today, someone that was referred to me, and this is what I was diagnosed with. It's called Symphysis, Symphysis, Pubis Dysfunction, pelvic pain. Contents. One problem that may present and pregnant women complain about is pubic pain. Yet doctors and midwives often dismiss this pain as either inconsequential or unfixable, or just one of those pregnancy discomforts that have to be endured. Occasionally, some uninformed doctors have even told women that such pubic pain means that they would need an elective cesarean section in order to not permanently damage that area during birth or as a result, of prior damage to the area. Yet none of this is true. Pubic pain in pregnancy is certainly not inconsequential. Common knowns from experience that it can be very difficult to deal with. Although many doctors and midwives do not know what causes it or how to fix it, many women are able to get improvement or relief with chiropractic treatment or osteopathic manipulation. It is not something that you just have to live with. And although extra care should be taken during labor and birth in order to prevent trauma, it is absolutely does not mean that you have to have a cesarean. I'm going to skip that part. It's just talking about the anatomy and structure. It's pretty much saying your pelvis is kind of a circular bone that goes around and almost meets in the middle to the front. The two sides do not quite touch. There's a small gap between them connected by, I don't even know what that word is, tissue, reinforced by several ligaments. This area is called the pubis symphysis. This is important for helping your pubic bone to move freely, stabilizing the pelvic while allowing a good range of motion. Simply put, this is my kind of thing, significant pubic pain is caused by the pelvic girdle area not working the way it should, probably because of hormones, misalignment of the pelvis, or the interaction of the two. It says the pubic symphysis and the sacroiliac joints in the back of the pelvis. You guys just read this if you want to and laugh at the way I'm saying all this medical term, are especially important during pregnancy, as their flexibility allows the bones to move freely and to expand to help a baby fit through more easily during birth. In fact, pregnancy hormones called relaxin and progesterone help the ligaments of your body to loosen and be even more flexible than before, so that there are plenty of give and lots of room for the baby to slip right through. However, in some women, even because of excess levels of hormones, extra sensitivity to hormones, or pelvis that is out of alignment, this area is extra lax, or there is extra pressure on the joint. So simply put, significant pubic pain is caused by the pelvic girdle area not working the way it should, probably because of hormones, misalignment of the pelvis, or interaction of the two. Although not every provider has a name for this condition, it is most commonly called SPD, or Symphysis pubis dysfunction, especially in Britain. Other names include pubic shear, blah, 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 blah. It's pretty much SPD, what I just called. Symptoms. The symptoms of SPD vary from person to person, but almost all women who have experienced substantial pubic pain, tenderness, and pain down low in the front is common, but often this pain feels as if it is inside. The pubic area is generally very tender to the touch. Many moms find it painful when the doctor or midwife pushes down on the pelvic bone while measuring the uterus fundal height. Any activity that involves lifting one leg at a time or parting the legs tend to be particularly painful. Lifting the leg to put on clothes, getting out of the car, bending over, sitting down or getting up, walking upstairs, standing on one leg, lifting heavy objects, and walking in generally tends to be very difficult. Very difficult. Many women report that moving or turning over in bed, excruciating, especially excruciating. One woman wrote, "There were days that I didn't think I was going to be able to get out of bed and actually had to roll out of bed onto the floor to be able to do so." My feeling is, if there is a fire, how am I going to get out? Because I have almost like a freezing where I freeze and I have to wait a few minutes before I can move my leg. So if there's a fire, how am I going to get my child and myself and my husband out? So it hurts so bad and I can't move my legs. Many women with SPD also report very strong round ligament pain, pulling or tearing, feeling in the abdomen when rolling over, moving suddenly, sneezing, coughing, and getting up, etc. Some chiropractors and PTs, physical therapists, feel that round ligament pain can be an early symptom of SPD problems and indicate the need for adjustment. Other providers consider round ligament pain normal, part of the body adjusting to the growing uterus. If experienced with pubic and low back pain, it is probably associated with SPD. So it goes on, and it says, to summarize SPD in the mild form of this problem, its symptoms often include one or more of the following. Pubic pain, I have. Pubic tenderness to the touch, having fundal height measured, may be uncomfortable, I have. Lower back pain, especially in the sciatic area, I don't have. Difficulty pain rolling over in bed, I have. Difficulty pain with stairs, getting in and out of cars, sitting down or up, putting on clothes, bending, lifting, standing on one foot, lifting heavy objects, etc. I have. I have lifting any objects. Sciatic pain in the buttocks and down the leg, I don't have. Clicking in the pelvis when walking, I have. Waddling gait, I have. Difficulty getting started walking, especially after sleep, I have a lot. Feeling like a hip is out of place or has to pop back into place before walking, I'm just starting to feel that. Bladder dysfunction, temporary incontinence at the change of position, that started yesterday. Knee pain or one pain in the areas can sometimes also be a side effect of pelvis problems, I don't have. Some chiropractors feel that round ligament pain, sharp tearing or pulling sensations in the abdomen can be related to SPD. I'm not seeing their chiropractor, so I don't know. No one knows why SPD occurs for sure, what happens in some women and not others. So I'll let you guys finish that if you're interested. I just wanted to let you guys know what I finally found out about my pelvic pain. I am on, I'm just going to cover this, temporary bed rest and limitations. I am also seeing the PT/MD twice a week, and I am to do these exercises. If you're interested in the exercises I'm doing, leave a message. Let's see where I'm at. I'm going to go over. So leave me a message, and I'll write to you what these are. They're mostly with the ball. This one right here is with the ball as well. It just doesn't show it with the ball, and how many times I should be doing that. And I need to be doing Kegel exercises at least 10 to 15 times a day. So I'm glad I know what's going on. It sounds exactly what I'm going through, and I'm glad I'm going to try, well, they're going to try to help me. So everyone take care. I'm doing well. 34 weeks and chugging along. Talk to you guys later. Bye.